What is a reactive NST? What is a reactive NST? You can see the baseline fetal heart rate. Here the baseline fetal heart rate, is nearly 140 beats per minute. And you can see the beat to beat variability. There is 140, then fetal heart has gone to 150, then 150, then 158, then again 150. So there is a good beat to beat variability is normally present. Okay. Next, we have to look for the fetal heart rate acceleration. These arrows which is marked, this is fetal movements. This is fetal movement. That is, there is a NST machine which is connected to the electricity. Then there is a graph paper which is recording the fetal heart rate. Then there is a belt which is tied to the abdomen of the pregnant lady, and normally when you switch on the machine, you take the normal fetal heart rate tracings, and the pregnant lady is instructed that she is supposed to press the button on the belt whenever she feels a kick movement, so that you can record the fetal heart rate acceleration. So these pointers are the fetal movements, and she has pressed the button on the belt and you have taken the recording of acceleration. So this observation is done over a 20 minutes time, and you can see one acceleration, second acceleration, third and fourth. So there has to be presence of 2 or more fetal heart rate accelerations of 15 beats per minute, and it should be persisting for 15 seconds in 20 minutes time. So you can see there are 4 accelerations. So accelerations is also present, and there is no deceleration. That is, no dip of the fetal heart rate below the basal line. So all the 4 parameters are satisfied. Baseline fetal heart rate, which is 140, beat to beat variability present, acceleration, there has been 4 accelerations in 20 minutes time, and there is no deceleration. So it is a reactive NST. The baby is absolutely fine. So how frequently it should be repeated? At the weekly intervals. And when do you start doing the NST monitoring? Anytime after 32 weeks. Anytime after 32 weeks at weekly intervals. You need not hospitalize the patient. NST can be done on the OPD basis. NST machine is usually available in the labor room, in the antenatal ward, and even in the OPD setup. So the pregnant lady is called and NST recording is done, and if everything is fine, just a basic antenatal advice and just send her home, and we instruct her to check the DFMC, daily fetal movement count. Then next week she is called and again NST recording is done, and we continue this doing till 37 weeks. And if it is high risk pregnancy, then we assess and do the pelvic assessment and then admit her for termination of pregnancy after she has completed 37 completed weeks by induction of labor or by doing a cesarean section, depending upon whether it is a contracted pelvis, borderline pelvis, or a normal pelvis, and what is the risk of pregnancy. Okay, so it is recorded at the bi-weekly intervals if it is severe preeclampsia or a diabetic patient or IUGR. So depending upon it is a low risk pregnancy or it is a high risk pregnancy, weekly or bi-weekly NST recordings are done.